Good morning, friends. Hi, how are you? And I'm reading uh, the Hindu news that is published on 27th September. And this news is written by G. Anand Krishnan. And this is about with caption. It is with caption personal and public choices. Personal and public choices eroding health. Eroding means खराब करना धीरे धीरे. Let's read. The surge in NCD in India stems as much from today's hectic life. Hectic means busy lifestyle, as from unplanned urban development. Non-communicable disease (NCD) linked to lifestyle have surpassed. Surpass means आगे निकल जाना या जीत लेना. Communicable disease as the leading cause of lost productivity and premature deaths. Means एनसीडी जो नॉन कम्युनिकल डिजीज है उन्होंने हरा दिया है या उससे आगे निकल गए हैं सरपास द कम्युनिकेबल डिजीज as the leading cause, the main cause of lost productivity and premature death. According to a report in the Lancet journal, NCD, non-communicable disease, contribute to 52% of all disease burden and more than 60% of deaths in the country. Cardiovascular disease. Cardiovascular means relating to heart. Relating to heart, cardiovascular disease, cancer, cardiovascular diseases, cancer, tuberculosis, and other causes linked to tobacco consumption result in over a million deaths over a year. Tobacco related deaths are expected to double by 2030. Nearly 65 million Indians have been diagnosed with diabetes, and research suggests the average age of a person having their first attack is 50 years, at least 10 years earlier than in developed countries. Responding to its escalating means धीरे धीरे खराब होते जाना बढ़ते जाना escalating situation, the central government has come up with a national action plan and monitoring framework for prevention of control of NCD, non-communicable diseases. Giving the rise toll of lifestyle diseases, the Minister of State for Health, Faggan Singh Kulsate, told the Lok Sabha on July 22 that the operational guidelines have been issued this year for population level screening to detect diabetes, hypertension, and common cancer. The guidelines focus on triggers for these. Triggers means the cause, कारण. तो guidelines जो focus कर रही हैं on triggers, cause for these diseases found in the choices that people make. Okay, and it is also with caption personal and public choices eroding health. ठीक है, तो खराब कर रही हैं पर्सनल एंड पब्लिक चॉइसेस. तो उसमें वो ये कह रहा है कि द गाइडलाइन फोकस ऑन ट्रिगर्स फॉर दीज फाउंड इन द चॉइस दैट पीपल मेक, बट इट इज नॉट क्लियर हाउ सच एन एम्बिशियस स्कीम, एम्बिशियस मीन टू से हैविंग शोइंग ग्रेट डिजायर of succeed in future. Ambitious scheme would actually work at the level of the entire population, since the lead would have to be taken by the government, by the state government. Lifestyle risk factor are everyday choice in some cases, but they are also the outcome of poorly conceived official policies. Smoking or chewing tobacco, excessive consumption of alcohol, and a preference for highly processed food are voluntary choices with a direct harmful impact on health. But what choices do citizens have? If cities expand at the cost of walking, exercise, and cycling, if city governments are more sensitive to petrol and diesel prices and road building than to pedestrian means होता है जो पैदल चलने लोग, means पैदल यात्री, person who walks by foot. To pedestrian facility and public transport. Such cities end up curbing healthy physical activities and promoting car use, adding to the burden of air pollution caused by burning of biomass and unchecked construction dust. Bad urban planning thus produces a cocktail means होता है mixture of two things. Cocktail of risk factor for NCDs affecting millions. Cities have not read the warning yet. Public spaces lack green cover and low cost access to roads and parking for a large number of vehicles is given priority. Policymaker must alter course through progressive step. Alter means change करना. Course means कोई भी path. Course. The cost of inaction. मतलब inaction ना होना, inaction will certainly be high. Changing profile of hospital patient reflects a sharp rise in cardiovascular relating to heart endocrine disorder. So that's for today guys, bye bye, take care.